Hello, everyone, and welcome to another exciting episode of the Think Oral Health podcast, where myself and Dr. Jonathan Levine spotlight leaders in healthcare policy, technology, and oral health that bridge the gaps and build bridges across silos. We're very pleased today to welcome our next conversation partner for this exciting topic today, Dr. Scott Howell. Scott, welcome to the podcast.
Thank you so much. I'm so excited to be here.
I'll start by doing a brief introduction to you, Scott. We're very grateful to have you. You're not only an associate professor and director of public health dentistry and teledentistry at the Arizona School of Dental and Oral Health, you also serve as a clinical advisor for Mouthwatch Teledentistry platform and a senior Atlantic fellow for health equity. We're very pleased to have you because of your notable academic career, but also because of the fact that your work in overseeing dental programs provide care for individuals experiencing homelessness, teenagers in county detention, and men coming out of prison going through substance use treatment and counseling. Your stellar career is very impressive, but your role in the community and offering access, bringing access to dental care to some of the underserved communities is even more impressive than that. So thank you for all you do, and thank you for joining us on the podcast today.
Yeah, I'm thrilled to get to talk about some of the work I'm doing and also get to talk with you both. Thank you.
Thank you. Those of our listeners who are frequent listeners to this podcast have heard me and Jonathan describe ourselves as troublemakers for good. You squarely fall in that category. In fact, we know that you have gotten yourself in trouble, fun fact, with the military, not in any other country, but in North Korea. So sounds like you are a troublemaker, both in your professional life, but also as a tourist. So do tell us a little bit about how you got in trouble with the authorities in North Korea.
So I had the amazing opportunity to actually teach and live in South Korea for about a year and a few months. And it was absolutely amazing opportunity. I always tell people, if I'm going to get a tattoo one day, it's going to say, I found happiness in Korea. And it'll be in Korean and it'll say, 한국에서 행복을 찾았어. Because it was just an amazing opportunity for me to explore the world. Well, I had an opportunity then to go to North Korea. This was back in 2007, I want to say. And the relations between the two countries were very different at that time. But you still had to be very careful where you took pictures. And it was in the Gumgang mountain region, very, very famous mountain area of North Korea. And our tour guide from South Korea said, hey, let's take a picture here. And it was in front of this sign in Korean that said, we'll do it our own way, more or less. And all of a sudden, from the woods, you could hear whistles being blown at us because there were soldiers watching us every step of the way, and we had no clue they were there. And our guide was like, okay, go, 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 go. And, what's terrifying is like, those can turn into really bad situations. So I'm very grateful it didn't, but it was such a unique experience to go to North Korea and to see things through a very different lens. But I'm very glad I got back to the South.
Goodness. Yes. I had a chance to go to the demilitarized zone, the border between the North and the South Korea, where there's a lot of activity and economic activity back in 2011. Mm-hmm. And I can imagine, and even in the tourist areas where it was all very well kind of polished and scrubbed up of any military, was still tense. So yes. I can only imagine what that looked like.
No, and I couldn't communicate. Like there was no communication with North Koreans. Like anytime I tried to talk to someone, nothing could occur. It was a fascinating cultural experience to see.
Talk about cultural differences and cultural shock. So maybe we'll start there, Jonathan. What do you think? We like talking about leadership and culture and change. And so, Scott, in your current role, a trained public health dentist, an educator, and somebody who is deeply involved in care delivery in the community, overseeing that, what is the role in culture building and leadership that you see for us to be able to usher this new era of dentistry, if you will, One of our previous guests mentioned that dentistry is on the cusp of its golden age. And so tell us a little bit about, from your perspective, what is the role culture plays in that transitioning from traditional models of care to that next generation of dentistry, if you will?
Yeah, that's, it's so fascinating to me as it relates to culture, as culture presents itself I think in numerous capacities. It could be, and their identities. Cultures are forms of identities, I believe. And so all of us carries with us, different types of identities, race, gender, ability, disability, the list goes on, language, religion. And over the past, so I had the opportunity to come back to AT Still University, where I teach now at the Arizona School of Dentistry and Oral Health. And, the classes look so different now than they did when I was a student. I graduated in 2014. The face of the future dentist looks so different, and than the historical face of the dentist and the dental community. And one thing that is really important to me is to understand who are the faces, what makes them, what do they thrive off of, what's important to them. One big, very obvious shift is the gender difference in dentistry. Those who, dentistry has been, as we know, historically male, but I want to say in our current dental school, it's majority female. And that is, people come with their different lived experiences. Women come with different lived experiences than men. And that shapes the kind of healthcare providers we're going to see. I've interviewed applicants who may or may not end up coming to the dental school, but during the interview process, they tell me stories of driving hours and hours and hours to get to a dentist that speaks their family's language because they've come from Vietnam or China or somewhere in other part of the world. But the opportunity to see a healthcare provider who understands where they're coming from a cultural language perspective, is a very powerful aspect of healthcare. And so that part of culture and seeing the changing face of the future dental profession is really fascinating, because they're bringing different asks and different wants to us too. And we have to pivot. And it's, academia doesn't pivot quickly, but the face is changing quickly. And so it's an interesting journey to be on.
Well, Maria, a good follow-up to that, as I'm listening here, is to ask the question, what is the positive when you think about this dramatic shift in gender as it relates to the quality of care, the ability to listen to the patient? What is that shift in gender and more of a female percentage of the overall? What's the positive optimism there that we could look into the future for?
If it's okay, I'll kind of broaden it a little bit, just, the positive of just the general change. But to start,
answer their own questions, Scott. This is entirely friendly.
No. Because I love it, because it is like, change is difficult. And I think we all have to acknowledge that, like anything that we have to change. I mean, try putting on your pants the other leg first. And like your brain is like, wait, what are we trying to do here? So anytime there's change, I think it's important to have the conversation around what are the challenges we're going to face and what are the opportunities? What are the positives? When I was studying global health as part of my public health curriculum, we often talked about the role of mothers and the role of female caregivers in communities. And in many communities, the women in the community, whether it was their own children or they were other just caregivers within the community, in many cultures and communities, women are the primary health decision makers. They are the people who support the health and well-being of the community. And that could be, if we go back to, long time ago with, looking at like societies where men were the primary breadwinners, if you will, and so forth, or even going further back where, the male part of the community was out there hunting and gathering in some capacity. It's really fascinating to see just the different levels of compassion and empathy. And I think even the less or the more conservative approach that sometimes our female students will take as compared to our male students. So like when I read evaluations of the students and the experiences they're having, they do fourth year externships at health centers around the country. And I'll often read that our female students might be a little bit more conservative as compared to the male students. And so why is that positive? I think that's positive, a more conservative approach, because that is the way dentistry is going. You know, we're not, I was listening to your podcast with Dr. Norris talking about the unethical aspect of patient-based board exams, because we've got this tiny little cavity that we used to like do a filling on to prove we could do a filling, but now there'd be absolutely no reason to fill that tooth. And because we have the medications, we have a more holistic approach. And so the positive that I think any change we see in the face of dentistry is bringing those lived experiences, bringing those different ways of approaching healthcare. Because we talk about what are some of the biggest barriers that communities face. It's not having a dentist who understands the challenges that they may be facing. And when you bring in those different lived experiences, we then can bring in the solutions to those lived experiences to break down the barriers. And that to me is one of the best positives. I mean, just the things that students bring to me that I would never consider are going to change the way we can deliver healthcare, I believe. But yeah, I'm very hopeful.
Yeah. No, I mean, I couldn't agree with you more. And as a clinician and also as an academic, you know, the shift, I couldn't agree more that from predominantly male to now you're really going more towards this direction of predominantly women. I look at it as a very big positive. My clinic that has always been my center of universe, out of 27 people, I would say there's about 20, 21 that are women. And, you know, the quality of care and the empathy and the listening and the listening for understanding and then developing treatment plans that are more minimally invasive and conservative. And how do I get to this solution in a way that is the least obtrusive and have a high level of quality of care? So I completely agree with you. It's an interesting direction. So, you know, Scott, you live in these different worlds. Tell us a little bit about at Arizona State, at the university. What are you seeing from a standpoint of innovation and newness for the education of these young dentists as we think about, you know, meeting the needs of the future? You know, what's the opportunity? Where are the areas that are the challenges? And because we all know how important it is for this experience in education for these young dentists.
You know, so I just met our first year students that just started last week, and I did this little activity. I had like a half an hour with them, and I wanted to get to know them a little better. So I would say, okay, stand up if you blah, blah, blah. And one of the first questions I asked was, stand up if your prom was canceled because of COVID. And about 10 to 15% of the students stood up. So, you know, that means those are the students that went right from high school to undergrad to dental school. It was much lower than I expected. It seems like we're having more students take maybe time off or sort of explore life, kind of like I did. I was out of school for 4 years before going back to dental school. And what I think is really interesting is they do not want to be read to. I mean, I don't think anyone does. When, you know, you've got a PowerPoint in front of you and, you know, I have professors who would just read the PowerPoint to us. And the fact is, and I don't say this, you know, I say this with a lot of love and compassion, you can learn most of the techniques of dentistry by going to YouTube. I mean, it's a technical skill that even when I was training in my hospital residency, the anesthesiologist said, "Hey, do you want to intubate tomorrow? Would you like to intubate the patient?" I said, "Oh, absolutely. That would be an amazing learning experience." And she said, "Okay, go watch some YouTube videos and then, you know, we'll come in tomorrow and I'll let you do it." And I was like, "Wait, what? They just go train myself?" I mean, of course she was there and, you know, she gave me like 10 seconds to do it. And then at that point she took over. But the simple fact is the technical skills of our profession can be learned almost anywhere in our students' lives because of the way the world is so connected now. What I think is important in dental education is to make sure that we recognize that people, the way we learn as humans is somewhat changing. But as we change the face of dentistry, as we talked about before, the way we teach is different too. And the way people learn is different. So like for me, I don't do traditional exams because I get like one day in my classes. I have like a 4-hour block. So I'm thinking, how can I really get the most out of this? I incorporate Kahoot. I love Kahoot because it makes it more interactive. It gamifies it. And then I throw in some gift cards, as like a reward to the first, second, third place. I make sure to, if I'm going to teach a class for 4 hours, at least 50% of it, if not more, I'm not talking. In some way, though, there's an interaction, there's a group activity, there's an opportunity to do Kahoot, there's some sort of hands-on experience. We have a great department of special care dentistry at the Arizona School of Dentistry. And so much of the curriculum they learn is the lived experience of someone with a disability. So we have tremor gloves. So they can put on these gloves, and then when they try to write their name, the tremor kicks in and they lose control. Or we have different goggles that simulate different visual conditions. The more we can make it a interactive, the more we can make it a hands-on experience, I think our students are going to be better prepared, especially as it relates to how to interact with humans. Because here's the craziest thing. When I look at some of these social media accounts, it's someone talking to themselves, but acting as different people. And that's something that I don't think that's the best way to teach our students, is to have them interact with themselves. They've got to interact with others. And so that's one of the things I think we have to continue to look at, is how can we engage with them to be the best communicators? Because I will admit, that is probably one of the bigger challenges I'm seeing. And so preparing them that way is going to be really crucial.
Right.
Much to unpack there. Yeah.
Yeah. Developing those soft skills. And we know in all of healthcare, that goes across the board, medicine and dentistry. And unfortunately on the medical side, managed care just kind of pushes down the time that a doctor might have for diagnostics and really listening to the issue, and technology is helping. And of course, the same thing goes in dentistry, and the ability to really ask these effective questions and understand our patients. And those communication skills are so important. And thus, I think it's very interesting, the trending that is going on. Amazing. So, Maria. I know you're thinking about something.
I do. I have. I really want to get Scott's thoughts on two aspects here. One, Jonathan, you and I talk about the adoption curve of technology in healthcare versus dentistry, right? And so Scott is a innovative educator, right, who's pushing the boundaries of what is the traditional model of education in the classroom versus the experiential model of education. Where do you see the role of AI and technology in bringing in graduating more empathetic, technology literate clinicians who are skilled clinicians as well, right? Do you see a trade-off between AI assisting in reading radiology or images versus the human eye? What's the role and type of technology in your practice?
We have, given that a lot of what I do is teledentistry based. So I'm working on telehealth connected teams where a hygienist is going out into a community setting, sending data back to me and my colleagues. We evaluate it and come up with a plan. In terms of other ways that the students are using it, our school has always been trying to, be on the forefront of technology, even since we're a newer school. We never had paper charts. We started with digital radiographs, digital EHRs. But even now, like I have a disclaimer at the end of my emails that say I use AI assisted technology to help with my emails, because sometimes I can't find the right words. And so I'll type up something, put it into Gemini, the Google chatbot, and have it spit back out make my email more empathetic or make my email more succinct, because I can talk and write a lot. What I want the students to recognize is that the technologies are not the decision makers, but I absolutely believe that the technologies can help us even understand ourselves better, understand I might want to be more empathetic in my email, but I might not know the right language that makes it more empathetic. Our students have to do reflective essays because there are soft skills that you can't evaluate with a multiple choice test. And, could they be writing those essays using AI assisted technology? Yeah. And that makes me a little nervous because I don't want them to write the entire essay just saying, give me a 3,000 word essay on patient communication. But would I want them if maybe they are a student who English is their second language? Absolutely. Why not use that technology to help them be successful? Same thing with radiology and radiographs. Why not use the technology in a way that will help us identify problems that we might not otherwise catch? But with the big caveat that in the end, if you're going to hand in a paper, you need to read it. You need to go through it. You can't just hand it in. Is it the language? Is it you, even though it might not be your exact words? I mean, I probably have a lot of people that are going to be mad at me for saying that, but I would be okay with that because I just need you to communicate the ideas. I need you to be able to understand what's on the radiograph. So if, the technology is saying, hey, there might be caries here, you should know if that is actually caries and then decide, how am I going to treat it? What am I going to do next? And I'm all for decision-making trees, things that help us make better decisions based on the statistics and based on the reality or based on the big picture. But we're still a human in front of us. And that human is not plugged into the internet. And so we still have to be careful to not let the technology lead us, but really make sure it's simply assisting. So I'm all for it, but, caveats.
Yeah.
There's a big difference between AI assisted and AI authored.
Yes.
Right.
Exactly.
And
exactly. The best expression I ever heard on this, which was really early on, is that AI is a co-pilot for us. Yeah. And as a co-pilot, we're leading, but it makes us more effective and efficient. And I love what you said about AI helping us understand ourselves better. And as, machine learning and computational science gets faster and faster as Moore's law and the ability, literally for computer knowledge to really understand and be and go beyond the parroting of what a human would say, but to go so deeper in our own understanding. I think if it's positioned properly, it just makes everything everyone does in every industry that much better. Not to be scared of it, but to embrace. I couldn't agree with you more on what you said.
Yeah, I think a lot about that notion of AI helping us or technology helping us understand ourselves better. I think of it as allowing us to personalize care to a much greater extent. And personalizing care means you could decide to offer a less invasive, minimally invasive treatment versus a restorative, more invasive treatment. Or you could also decide that this patient has special needs or they're differently abled, and you need to personalize your care and approach to them. The same way you personalize your care to somebody who is, a busy executive who needs to go see a dentist after hours, or a single mom who has 2 kids and a day job that she can't take a break from. So personalization of care is where technology could play a big role, in my view, across all different patient populations. What do you guys think 100%. About that?
Yeah. Well, there are companies right now. And so next generation of their product pipeline is not only reading x-rays and reading Panorexes and reading CBCTs, but the ability to write diagnostics of what exactly it's seeing to both the professional and also to a consumer side of the patient side, which is, not the dental language, but a language that the patient would understand both with a visual language and a written language. And that's right around the corner. In addition, both in all of healthcare, both dentistry and medicine, it's the same issues. The mouth is connected to the rest of the body. Treatment plans and treatment plan options based on machine learning, and hundreds of thousands of treatment plans and diagnostics, how we get to those treatment plans are right around the corner also. So, it's quite exciting what technology is going to do. But to Scott's point, we still have to lead.
Yeah.
It's not going to replace the healthcare professional, both in medicine and dentistry, but it's going to make us that much better. And the dentists need to have, as you think about the future, what Scott was talking about, the dentists need to have these soft skills in a very big way, more now than ever.
Yeah. Let's
sure.
talk a little bit about that. Scott, please chime in here. Let's talk a little bit about how technology allows us to take care of patients with different needs. What's your experience in that, and how are you incorporating technology to serve those communities?
So my background, a little bit, while I don't think, one's pedigree is their full story, as we were kind of talking about before we got started here. I had the opportunity to train at Swedish Medical Center and Seattle Special Care Dentistry, a really fascinating hospital residency that I spent a year at and struggled at because it was harder than anything I've ever done in my life, working in a hospital and just working with such complex needs. But with that said, one thing that I think technology, one of your podcasts, you guys were talking about Epic, and dental school, we're actually looking at exploring a new electronic health record and bringing, we brought Epic, or the folks that company brought them to campus, I guess. And when I was talking to the person leading this effort to change the EHR, I said, our medical consults would be lightning faster, not 100% better, but because Epic I use this in the hospital system, it allows us to pull records from other healthcare systems. I don't have to wait. I don't have to send out 30 different, medical consults for our patients with complex medical conditions. I can go to one resource and get their records and see, here's their last A1C. Here was their last, cardiology visit, and what the cardiologist said with their hypertension. I had the opportunity to partner with a clinic here in Arizona that they had something like 30 some specialties. They had never had dentistry, but we incorporated a hygiene clinic with telehealth capabilities so the hygienist could connect with me. And I had a patient there with 45 medical conditions, taking 26 medications a day. And because their care was centralized at this facility, I had all the information I needed in order to make the best decision for this patient. In order to know, because that's the thing with when I'm working with a patient with complex medical needs or disabilities, it's all about the accommodation that might be needed. Do I need to keep my visits short? Do I need to do SDF versus maybe a traditional filling? Because the only way we're going to do a traditional filling is if we do general anesthesia or sedation, which has its own risks. So oftentimes with my patients with complex medical needs, it's not, I wouldn't say necessarily the dental technology, although I give a lot of credit to CAD CAM, and you put the patient under once, you get the crown made, and you seat the crown, and you don't have to put the patient under again under general anesthesia or sedation to do the filling or to place the crown. Lots of opportunities there. But honestly, it's the ability to know, because one of my faculty, who he sadly died of Lou Gehrig's disease a few years ago, but he worked up until a week before he died. He did not let that condition slow him down. He was limited, but he always said, never treat a stranger. Know who this person is. And if I can use technology to have a better sense of who that person is, then I'll be a better healthcare provider. And Jonathan, like you said, we're oral health physicians. We really need to kind of move away from dentist, I think, in the way I was trained to think, because it's more than just about the teeth. We are physicians of the oral complex, and that is the whole body. It's just focused here. And if we don't understand the person sitting in our chair, we're going to cause a lot of harm. And I've seen that. I've seen dentists who don't know how to manage a patient who's had head and neck cancer treatment, radiation to the jaw. I've seen dentists who don't understand how medications interact and what they might do. And it's concerning. It's very concerning, because people are living longer. They're living longer with more chronic conditions, and we are more medicated than we've been in a very long time, because that is how we treat so many medical conditions. So knowing our patients, never treating a stranger, and using technology to make sure we're as informed as possible. Also, just, going to Google if you don't know what the answer is. I don't know what this med is. I can go to Google and find, the appropriate resource. And that's another thing. And then I'll shut up, because like I said, I can go on for a while.
Please go ahead. Yeah.
I tell the students, you can't know everything, but you need to know your resources. And the internet is a phenomenal resource. It's also a deadly resource if you don't know how to evaluate the quality of the information. That's evidence-based dentistry. That's evidence-based medicine, is being able to evaluate the quality. But a lot of healthcare providers don't have that skill because they were trained to use their hands more than to use their critical thinking, I think. And it's something we've got to work at, but the technology is there to help us do that too.
Yeah, that's exactly right. Stay right there with evidence-based dentistry. Dentistry has always been fragmented, has always been I like to refer to it as a solo climber sport. When I got into it, which was in the 80s, I literally couldn't believe how they didn't really have this working together mindset. It was really very, very solo. One dentist, one hygienist, one assistant. That was kind of the business model. And look how it's really changed over the last 40 years, where collaboration is in. Teams are in. Dental schools are working, as groups. Multi-specialty practices is the future. How do we collaborate? How do we have like grand rounds in hospitals? How do we have grand rounds in the dental office, which we do in our practice because we have all the specialists and we put all the data up. And even if it's a fairly simple case, we all learn together. But the trend is very positive, and technology is just an amazing co-pilot to really help us do that.
How does that, to both of you, how does that improve access? Because I think a lot about the dental deserts. And if we think that the access to dental care for a single mom of two healthy kids is difficult, think about two kids with special needs, that not every general dentist takes those patients. I saw an article recently that stuck in my head where there were kids in California with special needs that had to wait years to see a dentist who would take their insurance and who would take them as patients. And so there's this disconnect, at least for me, where we're graduating dentists from programs like what Scott is running, where we're expanding their mindset and teaching them how to know their patients and not to treat strangers. But at the same time, when they go in the real world, maybe under the pressure of school debt and the pressure of reimbursement, things change. So where is that disconnect? Is it we're not graduating enough dentists? Are we not incentivizing them appropriately? Is technology not fully deployed yet? What is there to be done for that access issue?
A lot of the way dental schools run is based on the Council on Dental Accreditation. I think I've got that acronym right, CODA. And CODA sets the standards. They tell us what we have to teach too. They don't tell us how to teach it, but they tell us what we have to teach too. For example, in the world of special care dentistry, as defined by CODA, is patients with physical disabilities, like physical intellectual disabilities, which I think are what most people think of if they think special care. They think someone with Down syndrome, intellectual disabilities, someone with learning disabilities, whatever it may be. Uses a wheelchair, for example, another example of physical. But then actually the other components of special care dentistry are geriatric, more focused on the frail elderly individual who is, on a lot of medications, oftentimes living in some kind of assisted care, long-term care maybe, and the hospital dental patient, which most dental students, that third one in particular, most of them are not going to encounter that patient because that's seen in more general practice residencies or in programs that have a connection to a hospital. Our dental school, for example, we don't have a hospital connected to our university, so we don't have an easy way to work to see that patient population. So with those three patients, the medically complex hospital patient, disabilities, and frail elderly, the challenge we have is, are our students ready? But more importantly, are the schools ready to teach it? Because CODA tells us, going back to CODA, they say we have to, I forget the exact standard, but it's something like the students have to be able to assess and manage the patient. Well, assess and manage simply means kind of like going through the medical history and determining if the patient can be safely seen in the dental office or if they have to be referred somewhere else. There is no treatment requirement from CODA. Now, keep in mind, just getting to manage and assess took years because initially it was you have to be able to assess the patient. But if there aren't enough faculty to teach these skills, because historically we haven't taught these skills, then who's teaching the dental students? So it becomes sort of this like
the standard of care for specialty care in dentistry is lower, is only assess and manage, versus the standard of care for other dentistries is goes to treatment.
Basically, I mean, it's the way you're saying it. I'm like, oh yeah, it is. It's that bad in a sense. But, wow. Like when you talk about, I had training from some of the top special care dentists, in my opinion, in the country. But, you start learning, like I think NYU, actually, Jonathan, you might be familiar. I think NYU opened up a special needs clinic recently.
University of Pennsylvania.
Yep. Thank you. I think under Mark Wolf, they opened up an amazing clinic. We've had a special needs clinic since our dental school started, but it takes infrastructure changes. And for these, established dental schools, that's millions of dollars you're looking at. So where are the resources? And you know what you don't get when you treat patients with special needs? More money, because it takes more time. You still
with the same procedure. That's right.
Yeah. And there are some codes, and Medicaid sometimes pays out on the behavior management code, but $10 doesn't cover the bills, for widening your doors and having a bariatric dental chair for patients who would not be able to sit in a traditional dental chair, for wheelchair accessible rooms. And then on top of that, I'll share my own story of a young patient had a pretty complex heart condition. And by the time he got to me, he got to the hygienist who we did a virtual consultation with him. He had been to 5 dentists, and the pulp was extruding itself from the tooth. There was such bad inflammation. In fact, you could see he hadn't even been chewing on the right side of his mouth because of all the calculus and tartar that had built up on one side of his mouth. This, not even teenager kid had been rejected by 5 dentists because of his medical history. So the technology, where does this come in? It's called a telephone. And you pick it up and you call someone to say, what do I do? Who you call, honestly, is the physician, and say, this kid has a complex heart condition. Is it safe enough? Does he have any limitations to his care that you are aware of? And the simple fact is this kid had no limitations because he was well managed, even though he had a complex medical condition. But even picking up that phone is just not something I think that we're training people to do because it's time consuming.
I'm a dentist. I treat teeth. I don't necessarily have to talk to the mental health physician or the cardiovascular physician or the primary care doctor.
Or, they write off a med consult that says, can I? And one thing we teach our students, you never ask for permission. You never ask a physician for permission to do a filling, a cleaning, whatever it might be. You ask the physician to tell me more about this patient that I might not already know, so that I, as the other doctor in this scenario, can determine if it's safe to move forward with treatment. And that's honestly what we spend most of the time talking to our students about, is how do you have those conversations? And I have seen some abysmal communication from clinics that I've worked with, in terms of how they communicate with medical colleagues. It's frustrating, to say the least. So the technology is pretty basic, but you know what I mean? Like, it comes down to, you've got to use it.
Yeah, technology is only as powerful as our ability to adapt business models and workflows and mindsets to it. Technology is never the barrier or bottleneck to changing care or bringing silos together. I'm yet to find an oral health physician who said, I wish the only thing that's preventing me from being an oral health physician is more technology. It's an enabler. It's a tool. And then it's up to the mindset and how we use it. So, Scott, you painted the very sobering picture of where dentistry is today for special care dentistry at least. What advice and where do you see that changing? How do you see that changing? There's a lot of, influential decision makers, patients, clinicians, administrators of benefits or education who want to do something about this or want to be part of the change. And so where do you see the change coming from? And is there a call to action or advice from you to those individuals who want to do something about it?
I think one of the most important parts is education. But the simple fact is, we're not, there are a lot of people who aren't going to go back to dental school to get that education. So I think it is a matter of understanding one's resources. I think I would love for there to be, some kind of either reimbursement mechanism for dentists that spend additional time training in those areas that are needed, for CE, maybe making scholarships available. In fact, University of Washington, I will throw a plug into my colleague, Dr. Kim Espinosa up there at the Decode Clinic. And I apologize, I can't remember what Decode stands for, but it's their special needs clinic at UW. She has a fellowship program, a short, like a 1 week, or I think you can come by, over 3 weeks over a period of time. But if folks want to look it up at DECOD, that their Decode Clinic, they offer hands-on training. They also offer for those living in Washington, working in rural areas. They've had some scholarships in the past to cover the cost of the training too. So there are some folks out there doing that. I think there's opportunities for us to look at maybe dental practice acts and to look at what CE is required. We require CPR. You've got to be re-registered every 2 years. But CPR only gets you so far. You want to avoid the emergency. That's the whole part of special care training, is making sure you don't get to the emergency. You're prepared for it when it happens with CPR, but you know how to avoid it with special care training. I think also awareness, as we were talking about, my background is the Disability Pride Month flag. And I didn't even know this was a thing until last night, actually. I was going through some emails, and I got an email from the American Association of Public Health Dentistry about Disability Pride Month. And I think taking time to understand disabilities and understanding what the challenges that people face, it's a step. It's not the end step, but it is a step in the process. And understanding, like, the men I work with coming out of prison who are dealing with substance use issues, all of them are telling me about the coping skills that they are learning as a process, as part of this rehabilitation they're going through. I've had kids in detention tell me that they start using drugs because of loss, death, heartache in their own personal lives, because they don't know what other resources are available. They don't have access to other resources. And then I look at my own experience as a kid, as someone dealing with some invisible disabilities, and even being diagnosed very recently in the last year, learning more about how my brain works. I never had to go to rehab to learn coping skills. I never had to go to prison or go into jail to learn that substances aren't the only path forward. And it breaks my heart that we live in a system that is so flush with cash, but that you honestly have to be lucky. You honestly have to be lucky where you're born, the family you're born into, the life you're born into, to have access to those resources. And I was just one of the lucky ones, because I very much could have been on the streets due to my own disabilities that I've faced, that honestly I wouldn't even call disabilities. They're just who I am. But because they fall under the category of disabilities, I'm like, okay, that's what it is. I don't feel unable to do anything. I just have to learn how to work with it. And that's what this is all about, is understanding what our patients have to work with. So if I've got a patient with ADHD sitting in my chair in front of me, I'm not going to tell him, well, you just need to do a better job brushing. No, because a kid's not going to get a dopamine hit, which is the primary issue with ADHD, not having enough dopamine ready to go in the brain. I need to find, how can we incentivize it? How can we make a reward out of this? How can we make it novel so that it doesn't get boring? We have to move away from being, the kind of the patriarchal system where we just tell people what to do, but rather work with them. And that's to me, that's a crucial aspect of where healthcare, dentistry needs to move to. And so for those living with disabilities, for those who want to help them, begin to understand the condition better, and then I think we can have better conversations with our patients, and then change the insurance system to reimburse us to have those conversations with the patient, because no one's going to do it if they can't get paid for it. Honestly, why would they? Because there's so much else to do.
It's not a niche thing, right? It's 25 to 30% of Americans live with some sort of a disability. So this is just a small subset of the population, is truly a myth.
Yeah.
And thank you for sharing that, Scott. Yeah.
No, that's is so poignant and so important. Where the dental schools have to really, Scott, I'm sure you would agree. Every dental school has to have a division or a subset of teaching for special needs, because it isn't such a small little piece. It's bigger than everybody realizes. And what you said was, I think we have to underline it. You know, the people who were not lucky to be born under the opportunity to take care of these needs and to have the healthcare professionals around you, we can't forget about them. And that's where the empathy needs to come in. And thank you for shining a light on that and working on that. And hopefully the dental schools will and the educators will help bring in this new generation of dentists with a much greater awareness. Well, Maria, this was amazing. This was amazing. And really, Scott, thank you so much for bringing this conversation to us.
I appreciate the opportunity to share, a little bit of what we're working on. The exciting part is, what do they say? Change. The only thing constant is change. And so I fully believe that as we have more of these conversations, that, like you said, as we build these clinics, it's slow. But that's also my world of public health. You even mentioned it in one of your podcasts, the 17 years before clinicians actually adopt change, right? Yeah. But that's the thing. When we do the work that we do, we're the eternal optimists, because we know it's not going to happen tomorrow, but we know that it can happen if we keep working towards it. Patients with special healthcare needs are going to be better off in the future. Patients who are living in rural communities will be better off in the future. But it's going to take time and it's going to take a lot of work. So I think if we keep having the conversations and keep up the positivity, don't let the setbacks, knock us out, knock our feet out from under us. There's only sky's the limit. And I'm honored and thrilled to be able to have this conversation. Thank you for your time. And thank you for having these conversations that not everyone's having. It's fascinating to hear what you all are talking about in your realm too.
Just getting started. This is it. We're just getting started, and we would love to follow your success, your good work. We'll make sure that our listeners have a way to get in touch with you in the comments and the notes of this episode. And have Scott back. Have Scott back. We absolutely want to have you back. Celebrate some of the amazing work that you're doing.
Thank you.
Be great.
All right.
Fantastic.
Thank you. And I'll see you next time. Yeah. Thank you, Scott.